You have to be highly motivated, and then you have to keep it. You know, seeing less and less patients and seeing more and more of the medical staff, the nurses, the departments, the kind of interaction with the university, your hospital, and these aspects are a real burden, because it's not exactly my business. I mean, I'm not really passionate by how we could reorganize the hospital. I want to treat patients, that's my business. So keeping motivated sometimes, you know, wow, not so easy, not so easy. So that's why I decided to have a limited amount, which is never going to be reduced, of visits, of seeing patients every day, and getting to all the wards in my department to know exactly what is happening, not because people tell me, but because I am seeing the patients with them. And so working with real activity of psychiatrists is more and more difficult, but I try to keep it. I think if we begin losing it, and that's very easy, just believe me, it's very easy, then I will not be as motivated as I am.
Motivation is really about partly enjoyment, it's partly about inspiration, it's partly about duty. And I feel a certain sense of all those three things towards patients with severe mental illness. By and large, they have very big needs. So I think that those of us who are concerned with their care have a duty to think about those needs. I think the problems that they face are a kind of inspiration because they are in their nature so difficult, and we ought to take them extremely seriously. And then finally, I think the inspirational element spills over into the motivation, where we see progress, we can see change in the basic sciences, which are going to translate eventually into better treatments.
Well, child and adolescent psychiatry is fascinating because it is very, very complex. You have a patient. The patient can be 6 months old, 2 years, 5 years, 10 years, 15 years, with a family, they are not together, they can be together. So you have so many situations and so many different disorders that it is always something very different. You cannot be bored with child and adolescent psychiatry.
I think it's the richness of what is in psychiatry. So medicine is a very broad church, and so is psychiatry, that within psychiatry one can be rubbing shoulders with people who are practicing psychiatry, but are also, you know, we say I'm an academic, so I'm speaking from an academic perspective, but it works on many other things as well. Could be an epidemiologist, they could be interested in genetics, they could be interested in imaging, they could be interested in relationships, they could be interested in psychotherapy, in the mind, clinical trials, history, economics, sociology, the law. All of these can contribute to making a good psychiatrist. And I just don't think there's any other branch of medicine that has that richness of variety within it.